So I just want to start off by asking, what is it like being a public health dietitian? What is it like? What does that world look like?
It's very exciting to me. I get to every day come in and help people to become their best self, to help people who are struggling with tough diagnoses such as diabetes, and filter through all the information that's out there and figure out the best way to take care of themselves.
So where did this passion come from? And how long have you been working with the Mississippi County Health Department?
So I've been with Mississippi County Health Department since October of 2015, but I've been a dietitian since June of 2002. And the
Okay.
passion came from just watching everybody a bunch of people in my family go through struggles with chronic diseases, struggles with their weight. And then I just have an overall passion for food and for eating and just keeping things healthy. And it came from my personal life with the family, but it also came from my years of working in the hospital and seeing people diagnosed with diabetes and watching those people come back and their health status keeps deteriorating, and they have to have amputations or they go on dialysis. And so my passion in the public health sector is really to try to prevent all that, to keep people out of the hospital, keep people at home, and keep them living the happiest, fullest life that they can.
So what can be done to delay the process of being diagnosed with diabetes?
The first thing would be physical activity. At the very minimum, trying to get 30 minutes of physical activity 5 days a week. And I'm not talking going out there and running or doing marathons. I'm talking about walking, just getting up and moving to where your heart rate gets up a little bit and get your muscles moving. That's kind of one of the first things. The next thing, if you are drinking a lot of sodas, whether they're really diet or sugar sweetened sodas or any other sugar sweetened beverages such as sweet tea or lemonade or Kool-Aid, reduce the amount of that you're drinking. Keep it to about 8 ounces a day if you can. And you don't have to be there tomorrow, but slowly reduce the amount that you're drinking. Reduce the amount of added sugar in your foods. Reduce the amount of sweets and desserts. A couple of times a week, a sweet's not a big deal, but when it's an every night thing, if you're getting your ice cream every night, it becomes a bigger deal. So that would be the next thing. The next thing would be to look at less processed foods that are higher in fiber, more foods that look like they do in nature, so vegetables and fruit. Those would be great. And just pay attention to the amount of sauces you put on your food and additives. But the biggest part would be eating food that is real food rather than packaged food, getting that physical activity, and reducing the amount of sugar in your diet.